All right, today we've got a real medical detective story for you. We're going to dive into a case that starts with what seems like, just some common childhood symptoms. But as you'll see, it quickly spirals into this race against time to solve a really complex puzzle and ultimately to save a young patient from a very hidden danger. So just picture this. You have a 3-year-old who's sick. They've got a fever, there's a rash, and they're complaining that their joints hurt. Now, for any parent, that's obviously worrying, but it also sounds like it could be, a dozen different things, right? You're probably thinking, okay, a virus, maybe some bug going around. But in this case, this was the first clue in a much, much more serious investigation.
So this whole thing, it all went down in just a matter of days. And with each visit to the doctor, a new, really puzzling layer got added to the mystery.
And the case escalated fast. It all starts on July 3rd with just some foot pain. An x-ray comes back clear, so he's sent home. But just 5 days later, he's back. This time with a rash, hip pain, and a fever. An ultrasound hints at some inflammation, but again, he's discharged. By July 11th, though, things have taken a really serious turn. The symptoms are worse, now his wrist hurts, and the lab results that come back are so alarming, he's immediately admitted to the hospital. So once he's in the hospital, the doctors are really zeroing in on 3 main things: a high fever, arthritis, which is basically just inflammation in the joints, and this persistent, really suspicious-looking rash. These 3 signs, they become the foundation for this entire diagnostic puzzle. Now, with a trio of symptoms like that, doctors can't just jump to one conclusion. No way. They have to do something called a differential diagnosis. And honestly, you should think of it just like a police investigation. They've got to line up all the potential culprits, all the suspects, from the most common ones to the super rare ones.
And that is the huge question, right? Because these symptoms are so general, the list of possibilities is incredibly long and varied. The medical team has to be so systematic about this.
So first up, they tackle the arthritis. They have to consider a whole bunch of categories. Could it be infectious, from a bacteria or a virus that's gotten right into the joint itself? Could it be reactive, like arthritis that's triggered by a recent infection somewhere else in the body? Or is it a primary inflammatory disease like juvenile idiopathic arthritis? And they even have to think about the scariest possibilities, like leukemia, which can actually show up with bone and joint pain. And it doesn't stop with the arthritis. You still have the fever and rash to explain. So common viral infections, yeah, they're high on the list, of course. But so are things like rheumatic fever, which can pop up after a strep infection, or even systemic conditions like lupus. So you can see just how complicated this gets. The doctors are basically juggling multiple lists of possibilities all at the same time.
And this is where the real detective work kicks into high gear. With a list of suspects all lined up, the team turns to the evidence, the blood tests, the imaging, all the stuff that's going to help them start crossing names off that list.
Okay, the first major clue is this number, 120. This is the boy's erythrocyte sedimentation rate, or ESR. Now, to put that in perspective, for a kid, a normal rate is typically under 10. So 120 isn't just high, it's off the charts. It doesn't tell the doctors what's wrong, but it's basically screaming that there is severe body-wide inflammation happening somewhere.
The next clue is his white blood cell count, 26,000. Normal for a child his age is somewhere between 5,000 and 15,000, so again, really high. It shows his immune system is just in complete overdrive. And what's really important here is that the cells are mostly neutrophils. Those are kind of the immune system's first responders, which points more towards severe inflammation than, say, a typical bacterial infection.
So the clue board really starts to fill up. The high inflammatory markers confirm just how bad it is. A blood smear comes back with no blast cells. Those are immature cells that can be a sign of cancer. So, boom, leukemia is way less likely. A negative test for a recent strep infection rules out rheumatic fever. And then, a huge clue, a positive ANA test, which is a marker that often points to an autoimmune condition. And finally, the clincher. An echocardiogram reveals fluid around his heart, a crystal clear sign of internal inflammation.
Okay, so you can see where this is going, right? The list of suspects is getting really, really short. With infection and cancer looking way less likely, all the evidence is now pointing overwhelmingly toward one specific type of disease. It's time to name the culprit. And here it is. The diagnosis is systemic juvenile idiopathic arthritis, or systemic JIA. Okay, let's break that down because it sounds like a mouthful. Juvenile just means it starts in childhood. Idiopathic is a fancy word for we don't really know the exact cause. Arthritis is that joint inflammation we've been talking about. But the most important word here is systemic. That means the inflammation isn't just in the joints, it's affecting his entire body, which totally explains the high fever and that fluid they found around his heart.
So how did they finally lock it in? Well, they just matched the boy's symptoms to the classic signs of the disease. Did he have arthritis? Check. Did he have those daily high fevers? Yep, check. Did he have that specific rash? Check. And the fluid around his heart? That is a textbook example of sericitis, number 5 on this list. It all fit. The puzzle was solved.
Okay, so the case is solved, but we're not done. Not even close. Getting the diagnosis is really only half the battle. Now treatment has to start immediately. And not just to make him feel better, but to head off a potentially catastrophic complication.
The treatment plan has 2 main goals. Right away, they need to get the pain, the fever, and that runaway inflammation under control. But long-term, the goal is remission, to stop the disease from causing permanent damage to his joints and his organs. And this usually means using some pretty powerful medications that can specifically target the parts of the immune system that are going haywire.
And this right here, this is why speed was so critical. A certain percentage of children with systemic JIA can develop something called macrophage activation syndrome, or MAS. And this is when the immune system goes from just being overactive to completely out of control. It triggers this massive, uncontrolled inflammatory storm that can cause organ failure. It is a true medical emergency, and it can be fatal.
Because of this risk, doctors have to be constantly on high alert for MAS. This table shows the specific lab criteria they're watching for, like a hawk. So, if a patient with systemic JIA gets a fever and has at least 2 of these abnormal lab results, like a spiking ferritin level or a plummeting platelet count, that's the signal that this incredibly dangerous complication is kicking in and aggressive treatment is needed right now.
Wow. Okay, so after going through that whole intense diagnostic journey, what are the most important lessons we can actually take away from a case like this?
If there is one single thing to remember from this whole story, it is this. What might look like simple growing pains or just a minor injury, it could be a sign of something much, much more serious. Joint pain in kids always deserves close attention.
You know, this case really hammers home a few key rules for this kind of medical detective work. First, the answer isn't always in a single test. This was a clinical diagnosis, solved by putting all the different clues together. Second, certain patterns are just major red flags, like that combination of daily spiking fevers, a specific kind of rash, and those crazy high inflammatory markers. And finally, you learn that time is absolutely everything. Early treatment is crucial because the shadow of that dangerous complication, MAS, is always there.
And that really leaves us with one final kind of chilling thought, doesn't it? This case was just a brilliant piece of medical detective work, for sure. But it's also a powerful reminder. I mean, how many other serious illnesses start out by just pretending to be the everyday aches, fevers, and rashes of childhood? It just underscores the incredible importance of vigilance, of curiosity, and of never, ever dismissing symptoms until you know the whole story.